Hello, welcome to AIISH, the Clinic for Persons with Voice Disorders. I am Dr. K. Yashoda, Associate Professor in Speech Sciences and Chairperson, the Clinic for Persons with Voice Disorders. This was established in the year 2012 with the aim of providing specialized services to persons with voice disorders. The overall goal is to increase the individual's level of communication and functional independence and to assist them develop skills that are necessary for coping with disorders. How are we functioning to achieve these goals? It is by providing effective diagnostic and management services using state-of-the-art equipment, regular guidance and follow-up services for clients who are registered at AIISH, counseling and guidance to family members to facilitate early recovery and also to avoid furtherance of psychosocial problems. We also are attempting to build the client caseload through camps, school screening programs, etc. The Professional Voice Care Unit was a specialized center in the Department of Speech Language Sciences, established in the year 2004, provided extensive services to the professional voice users such as singers, actors, teachers, politicians, advocates by carrying out detailed investigations for diagnosing and also providing management services so as to help them recover to their former functional capacity in terms of their voice expertise and also create an awareness among them to use their voice with a better purpose. The Professional Voice Care Unit is under the Clinic for Persons with Voice Disorders. Shared faculty expertise and state-of-the-art equipment have strengthened our motto and help us in dealing with both professional voice users and non-professional voice users for elevating their voice complaints. Apart from me, the team comprises of Dr. T.K. Prakash, Associate Professor in ENT, specializing in laryngology, Dr. T. Jaikumar, Associate Professor in Speech Sciences, Dr. R. Raj Sudhakar, Associate Professor in Speech Sciences, and Dr. R. Gopi Shankar, Research Officer. All have expertise in voice disorders and voice sciences.
My name is Dr. R. Raja Sudhakar, working as Associate Professor in the Department of Speech Language Sciences at All India Institute of Speech and Hearing, MYSURU. I am going to talk about perceptual evaluation for patients with dysphonia. At AIISH, along with objective analysis, we do perceptual analysis also because it is considered as one of the gold standard assessment tool for voice analysis. And I am going to talk about consensus auditory perceptual evaluation of voice, that is CAPV. CAPV has 3 tasks. Task 1, we ask the patient to take a deep breath and phonate 2 vowels, that is vowel A and vowel E for 5 to 8 seconds. The second task is they have to read 6 standardized developed sentences, and the third task is spontaneous speech. And these samples needs to be analyzed under 6 voice quality: roughness, breathiness, strain, pitch, loudness, overall impression about the voice quality. This particular tool uses visual analog scale. The resonance part of the voice has to be noted down in CAPV. Either it is normal or abnormal. This CAPV tool has high reliability with other perceptual assessment tools such as GRBA scale.
Hello, myself Dr. T. Jaikumar, working as an Associate Professor in Speech Sciences at All India Institute of Speech and Hearing, Manasa Gangotri, Mysore. We are going to talk about the instrument called WAGMI. WAGMI is one of the indigenous software developed for the assessment of speech and voice and also for the treatment purpose. This instrument is developed by Voice and Speech System, Bangalore. Using this software, we can do analysis on frequency, intensity and perturbation related measures, inverse filtering, glottal noise related parameters. This WAGMI also has a treatment module which includes respiratory training module, pitch and loudness training module, articulation training module and intonation training module. Using these treatment modules, we can measure the progress of the treatment and also pre-test and post-test assessment. Multi-dimensional voice profile, in short MDVP, is one of the widely used software for the voice analysis. Using this software, from the single phonation sample, we can able to assess more than 30 different parameters of voice. Apart from that, MDVP also gives a graphical representation. From this, we can understand whether the voice is normal or abnormal by utilizing the color. Lung air volume is the main source for the voice and speech production. Generally, the lung volume will be different for males and females. Males will be having more lung volume compared to female and children. Spirometer is the instrument for measuring the volumes of air inspired and expired by the lungs. Using this spirometer, we can measure mainly the vital capacity. Vital capacity reflects the amount of air utilized for speech and voice production. If the vital capacity is less, we cannot use longer utterances in speech as well as in voice. Generally, we experience voice fatigue when there is a less vital capacity.
I'm Dr. R. Gopi Shankar, working as a research officer at All India Institute of Speech and Hearing. Electroglotography is another state-of-the-art equipment used in assessment of voice disorder. We call it as EGG. EGG gives information on the surface contact of the vocal folds. While doing the measurement, the gold-plated electrodes are placed in the side of the thyroid lamina and the patient is asked to phonate ha. And based on the waveform, we can identify the presence and absence of voice pathology. LingWaves is another state-of-the-art equipment used for persons with professional voice users, where we can measure vocal loading testing, singing range profiles and other parameters. The software gives information on a live recording for singers, where we can measure the pitch range for singers. Doctor speech is another state-of-the-art equipment for persons with voice disorder. We use doctor speech to estimate the voice quality for person who is having voice problem. The unique features in this particular software, it calculates and estimates and provides the voice quality in terms of graphical representation. Commonly used voice assessment protocols are electroglotogram, WAGMI, multidimensional voice program, doctor speech, LingWaves. These softwares gives information about the pitch related information and loudness related information on persons with voice disorders. The derived parameters are subjectively and objectively correlated for the final diagnosis.
Hello, I am Dr. Prakash TK. Today I will be explaining the visual examination of the larynx, how we conduct at our institutes. So as the age advanced, so many other diagnostic modalities which were far better than this mirror examination. So whatever we see through the endoscope, the laryngeal images, everything, or whatever the disease that is there in the larynx, what is the function of the larynx, how the vocal cords in the larynx are moving, all those things can be seen through the endoscope, and this can be monitored and it can be seen through in the television or in the monitor, and it can be shown to the patients, and a good education can be given to the students. The third part of this is the flexible laryngoscopic examination. In some patients where the patient cannot open the mouth properly, or when they are non-cooperative for the procedure, then we can use a flexible endoscope. This flexible endoscope is introduced through the nose. We can directly visualize the voice box or the larynx. We can see the movements of the vocal folds. We can see whatever the disease that is there. This is known as flexible endoscope, and here also the optical fiber plays an important role, and this optical fiber is a flexible one, and this is a newer diagnostic modality. where the diameter of the endoscope is slightly bigger, it is about 10 millimeter. So it is at a 70 degree, usually 70 degree or a 90 degree endoscope. So we can see how the vocal folds are approximating, that is if there is any gap between the vocal folds or any lesion means any growth is there on the vocal folds, or whether both the vocal folds are not closing. Like that we can diagnose multiple pathological things which are cause for the voice disorder. So we can come to a conclusion, a definite conclusion, whether the patient can be helped by just giving him a voice therapy or by just doing a surgery or whatever the treatment modalities that can be adapted by doing a stroboscope.
Invasive equipment such as laryngoscope, video endostroboscope have helped us identify the cause of the voice problems more readily. We are ably supported by the state-of-the-art facilities available in quantitative acoustic measures that help us in identifying the physical and psychophysical characteristic of voice for better service delivery. My sincere request is, please don't ignore or neglect voice problems. Please consult a professional for your voice problems at the earliest before it turns into a major issue. You are free to call us and seek our guidance and support anytime. Thank you.